Hello, I'm Dr. Rohini. Today I'm going to talk about how we are going to treat a patient with diabetes in pregnancy. So, first of all, it's important to have a healthy lifestyle. So, the patient is advised to have an active lifestyle, to at least go for 30 minutes of walking every day. This will also help in lowering the sugar levels. The second important part is to have a very healthy diet. So, either on your own you can follow a low carbohydrate diet, or you can also take the opinion of a dietitian. It's important that the diet should have less of carbohydrates, high in fiber, and good protein amount should be there in the diet. Now, despite the diet and exercise also, if the sugar is not getting control, then the third option would be to take some medicines. So there are certain injections and medicines. So the medicine that is commonly used is metformin. These tablets can be taken up to 2 grams in a day. So this is usually taken after food, and this baby friendly. This will not cause any abnormalities in the baby. So usually we can, this is easier for the patient to take compared to injections. After starting metformin also, your sugars will be monitored, and in case if the sugar levels are not under control, the next option would be to take an insulin. So insulin injections are the best thing to lower the sugar levels, but yes, taking injection every day may be a little painful or difficult for the patient. So usually there are two types of insulin. Either sometimes insulin is given after every meal, or it is given which is called the short acting insulin, or a long acting insulin can be taken only morning and in the dinner time. And when you are taking insulin injections, it's important keep some chocolate or sugar next to your bed, because sometimes insulin can cause a condition called as hypoglycemia, that is sudden lowering of blood sugar. Because of that, you can have sweating, you can have tremors in your hand, or you can suddenly feel like fainting. So this is some of the complications that can happen, or side effects of insulin injections. So these are your options for treatment of diabetes in pregnancy. And now next part is when to deliver a patient and how are we going to deliver. Diabetes doesn't mean that you have to deliver the baby only by cesarean section. If the weight of the baby is good and everything is fine, then you can opt for a vaginal delivery. If the weight of the baby is more, that is around more than 4 kg, if there is a lot of water around the baby, if the blood pressures are high, then the patient is offered a cesarean section. And usually the delivery is planned after 38 weeks. This is done because usually in pregnant women with diabetes, their babies may have a delayed lung maturity, and they may face some breathing difficulties after birth. So it's important that their delivery is planned after 38 weeks. And I hope I was clear in explaining about how we are going to treat patients with diabetes.